Okay, all set. Thank you.
Thank you. Good afternoon, everyone. Thank you very much for joining us today. We're going to be starting out the call today, endeavoring to bring you up to speed on everything that's been going on since the last time we talked with you. I want to talk a little bit about what the Early Learning Division's emergency action plan is related to childcare so that you can be aware of that. We also want to touch on, and I'm going to have Margie and John do this, we want to talk a little bit about the CCR&R role in this public health emergency and what we're asking them to do, and just give you a little update on a variety of things associated with our response. So let me talk a little bit about ELD's emergency action plan. So we're working on 5 key things associated with our response to COVID-19. There's other things as well, but these are associated with childcare. So those 5 things are, we are working to keep childcare open for working families who are required to continue working because they are essential personnel or are otherwise required to work. We are working closely with a variety of organizations and a working group out of the governor's office to potentially open childcare for working families who are required to continue working because they are essential personnel or otherwise required to work. We are working with 211 to prioritize the linking of families who are essential personnel or otherwise required to work to emergency childcare so that we can make sure that the healthcare system in Oregon can continue to function and that essential services that we depend on as states and communities can continue to operate because families and parents work in those services and need support to do that. We are creating a process by which we're able to recruit, vet, and deploy temporary childcare workers. These would be individuals that would sign up to be temporary childcare workers. They could potentially serve as substitutes for programs that are having difficulty operating because they can't get staff. They could also serve as staff in the emergency childcare centers that we're working to open. And they may also go into a home of a essential personnel or another individual who needs odd hours or after hours care. In order for that to happen, we have been working closely with the governor's office and expect an executive order later today that will allow Miriam to be able to make some changes temporarily during this period of emergency that would allow us to expedite background checks and to offer a slightly reduced requirements associated with training. And once those individuals pass the background checks and complete the training, then we'd be working to make sure that their information is updated into our childcare database, which is held in a database called NACRAWare. And the CCR&Rs are responsible for keeping that database up to date with complete and accurate information. And I think Margie could touch more on that if people have questions. The other thing that we're working on is making temporary changes to ERDC that would last during this state of emergency. And we expect potentially to communicate more specifics about this later today. In terms of the other pieces of work the community systems team is working on, and then I'll also see if Gwen wants to add anything. We're working to help keep HFO operating, albeit in a remote, online, by phone, text kind of approach, but we feel that it's crucial and critical to keep the programs operating here that support the most vulnerable families in Oregon. And so far, we've got great participation still going on with HFO, and they are having regular calls with Elizabeth Wood and our assistant support, and we're working closely with the Healthy Families America National Office to make sure that we have everybody operating safely in services that they're providing. Betsy Imholt, our excuse me, we have all been working a lot of hours. Betsy Imholt, our deputy in charge of operations, is now serving as a part of what's called the Mass Care Operation Team. It's a part of our emergency planning here in Oregon. And so she's working with a group of individuals that are thinking about all the places and populations in Oregon that are in care. So that could be nursing homes, that could be children in foster care, that could be, in our case, childcare, and she's representing the early learning division on that team, and will be helping to continue to make sure that the needs of childcare providers are addressed. We are in close and nearly continuous communications and consultation with the governor's office, OHA, ODE, and other state agencies, as this is a situation which you've all personally experienced is changing very quickly, and we are endeavoring to make sure that our efforts, both at the Early Learning Division and the Office of Child Care, align with those quickly changing things. So that means it would be reasonable to expect you could see updates daily or more often, and that we are working very hard to make sure that you are in the loop with those changes as soon as we know them and can communicate about them. I'd like to turn it over to Margie to talk just a little bit about the CCR&R role, because we'd like to make sure that you understand it and how important it is for you to be supporting the essential work they are doing now during this public health emergency.
Thanks, Joan. Hi, everyone. The CCR&Rs are primarily responsible, as you all know, to recruit, train, and retain child care providers. One of the first things they're doing is they are calling all the child care providers to find out specifically if they are staying open and if they are willing to take emergency child care. As you may know and remember from the data work that was done during ECE sector, some providers have desired capacity. There is a request to see, for those who chose desired capacity, if they'd be willing to go to full capacity and have emergency child care slots. We have changed the database to incorporate fields for emergency child care. We're also tracking temporary closures so we can be sure to query that when this is over and encourage providers to open again. We're sending out a survey to all the providers in the database to see what they need to stay open, including supplies such as sanitizers, diapers, baby wipes, as well as food. And then we will be strategizing ways to get those resources to the providers, and the CCR&Rs are going to be coordinating a lot of that. They are also updating the database on a regular basis. So as we're getting the information about people willing to staff, to be substitutes, and to actually open their homes to provide childcare during this period of time, we're going through a, as Joan was saying, kind of a condensed licensing process where they will have a criminal clearance check and they will have some basic health and safety training that is online. They will then be approved and their information will be entered into the database. In order to keep that very streamlined, that information will be entered by the Research Institute NACRAWare team. And then the CCR&Rs will be updating that on a weekly basis so that we can be sure that the referrals that 211 provide are very current, updated, and there are vacancies. 211 is responding to referrals, as you all know, and they are coding those that are first responders and medical staff and prioritizing those referrals and providing what we call enhanced. They're kind of enhanced plus referrals, I should say, where they are making sure that the lists that the first responders get have openings. The CCR&Rs are backup to referrals, so CCR&Rs will be doing referrals again, and many of them already are because of the needs in the community. They are, we we have an agreement with 211 and CCR&Rs that we use the no wrong door policy. So if CCR&Rs get referrals, they will respond and provide a list to those calling. So we've set up that database so that we can capture these fields and we can sort to be sure and provide the emergency care slots to those calling. CCR&Rs are also making sure to connect people to any of the trainings they need online. So we're working on that to make sure people can stay licensed during this time, just in case a renewal comes up. So they are working very hard to keep child care providers open and accepting children and getting what they need to stay open. Are there any questions? John, did I miss anything? Oh, okay. Hi.
Hey, one question I had is earlier today I was able to be on a phone call between a district and a private provider, the Offshoot KinderCare, and the district's thinking about trying to stand up some child care provision, potentially for first responders, but also just general child care, either for school age and sub-school age. And I'm wondering where those conversations are kind of happening, because it felt a little bit disconnected, I guess, because I was only brought in by happenstance through a different district staff person. Otherwise, I would have been totally unaware about that process. So I think it's good to understand what role school districts might be asked to play, and how hubs can support, potentially bringing in other community partners into that conversation.
So this is Joan. I think I'll take that question. So it is still in the process of being figured out exactly the role that school districts will play. It is my understanding that we're moving towards schools potentially being opened and made appropriate for children from birth to age 12, in terms of being able to serve as child care providing spaces for the personnel that we've been talking about, first responders and other healthcare staff. That's not all yet been exactly determined, but we are acting as though under direction that we should be pursuing things like classroom setup, and we're developing guidance that can be used for schools that are opening, and these processes that we're talking about for staffing different settings all apply to schools as well. And I think it's something I'd like to hear from all of you once we see if there's other questions, like what can you do to help support that work that is going on? Because certainly we would think that early learning hubs would be trying to help support community efforts during this time. And they're going to vary by community. In a few minutes, Renee is going to talk a little bit about what's happening already in her community. They opened up emergency childcare yesterday. So I think some of the community response really depends on the plans that are already in place in your community in case of an emergency such as this, a fire, a flood, and a pandemic. What is your community plan to assure that children of first responders and others who have to work have access to childcare? I think it's a time for all of us to notice if that's not in place already in our communities. That isn't necessarily some work we're going to do today, but it would be important to note that it could be really important to do as we're past the recovery of this process.
Thank you. That's helpful. I think the only thing I would say is just people should be aware that I think it's happening, and it may not be waiting for guidance is the way I'm interpreting what I saw. And so it may be helpful for us to reach out to district partners and figure out what's happening.
ELD is working closely with the Oregon After School Association because they provide what's called out-of-school time care, not just before and after school, but also often full-day programming in the summer over spring breaks. So we've been trying to work with them to identify all potentially available sites, understand what the capacity is. So I think the reality is that this is going to be a little, some things are going to happen very locally because plans are already in place. We're also working on a statewide strategy, like we are around getting us sanitary supplies and other things that providers need. But I think if there's local work that can happen to support access to supplies that providers need, I would encourage you to work with your R&Rs to do that, because that might help providers stay open. We'll know a lot more about the timeline of getting supplies on the ground from our end in the next day or so. But I think in this particular situation, being able to be abreast of what's happening in your broader region and how you can contribute to supporting work that's happening to keep childcare open, particularly for those first responders. We know it's a significant concern of the healthcare system here in Oregon that we absolutely have to keep childcare open so that we can keep our healthcare system running during this emergency. So that needs to be a top of mind for all of us.
Hey, Joan, this is Beth.
Yeah.
I'll just jump in really quick. Margie, when do you expect to get the survey results back from providers? Is there a deadline?
I believe so. I don't have that deadline right in front of me. The survey is now being translated, so it should be sent out today. So I believe it's a fairly quick turnaround, but I can get that information.
The English survey is already up on our website, and the English version will be sent out first, and then TRI is translating into Spanish and Russian. As soon as those are available, they'll be sent out to those providers and posted on our website. And as soon as we have the Chinese and Vietnamese, they will also be sent out and posted on our website. And then R&Rs will also send that information out, and we can certainly share those links in other ways through social media, etc. I imagine that we will also be sharing them with our different networks that we have as well.
Okay, great. And then if we have families that contact us, if they're not in the category of essential personnel, but they are required to work, who do you recommend we send them to 211 still, or what's the next spot? Okay.
Absolutely. In fact, those are the bulk of families that 211 serves, so they will continue doing that. They have a full team, just actually increased their team. They will continue to serve those calls that come in. They're required to respond within 24 hours, and they are also making sure their team is prioritizing the first responders and medical staff. But the other ones will definitely be responded to as well.
Okay, great. Thank you.
Any other specific?
Yeah.
Go ahead.
Hi, Joan and everybody. This is Lisa. And thank you so much for that update. It's really helpful. In fact, last night I had the question from a school district, so it's quite timely. Do you have kind of a timeline of what you're working on in terms of that guidance? So that we can be as helpful as possible to our school district?
Yeah, it's being vetted today by OHA, and as soon as we have approval to send it out, we'll start making it available.
Fabulous. Thank you so much.
All right. Anything else on the ELD response or CCR&R responsibilities at this time? Okay, Renee, I'm wondering if you'd be willing to just sort of start us off by talking about what the Southern Oregon Emergency Child Care Plan is, and like maybe just a bit about how it got made, and now that it's in place, we would just love to hear that as a kickoff.
Yeah, I have limited information, and I just want to be clear at the front that unfortunately the early learning system can't take credit for this emergency plan rolling out the way it did. And I really give credit to the executive director of the YMCA that serves Jackson County. And it really, I believe the secret sauce is that he had ongoing long-term relationships with school districts where the YMCA was providing after-school and day camp programs on the elementary school sites. And so that relationship was already established. And so Saturday afternoon, a press release went out saying that the YMCA was suspending all traditional after-school and day camp programs until schools reopen, and that resources are being reprioritized for an emergency child care plan that is specifically to support the medical staff, healthcare workers, first responders, and vulnerable populations who need to get to work. So being very clear about who was being targeted. Of our 9 school districts in Jackson County, 4 of the largest already had those relationships established, and there are 7 emergency child care locations within those 4 districts. He did not share how many children would be able to be served, but he did say that from 7:30 until 6 p.m. Monday through Friday, care will be available, that funding for the program is really coming from multiple sources, and that registration will be happening every morning on site, realizing that things could change drastically for all of those prioritized populations from day to day. The Early Learning Hub has been working with United Way, who's also interested in figuring out how we can support other programs, not just the YMCA, but other programs who are indicating they would like to be emergency child care sites. One of our Preschool Promise community-based centers has repurposed their services for emergency child care as well. And so we are working with United Way to get additional cleaning supplies, additional snacks, those things that they didn't have on hand that they were not necessarily prepared to either go out and get or absorb the expense for. And I think that is what I know right now, and unless there's other questions you want to ask. I did email the executive director asking when his hair is no longer on fire, if he would like to share any potential frameworks for a model that other organizations might be able to use to deploy a similar services in their community, to roll it out without needing to start from scratch. And I'm sure he'll respond once he has a moment to do that, but I can imagine that he's pretty busy at the moment.
Any questions for Renee? So as you all know, we sent out a survey yesterday as well that Brett and I sent just to get some information on what folks, different hubs were doing to respond. So I'm wondering if a few people might jump in and let us know what they're up to. Lisa, do you want to go ahead and share what you guys are working on?
Absolutely. So like everybody, we are canceling things left and right that are non-essential. We've canceled our KPI large event that we had planned in April, and various other Preschool Promise meetings that we had in combination with the CCR&R, and then beginning to take all of those offline, doing anything we can virtually, we're now card-carrying members of Zoom, and are getting cameras so that we can be seen. So that's kind of exciting to see that happen. We're also in the process of developing what we're calling a COVID campaign, where we are collecting and sharing out information to the community on various, whether it's lunch sites at schools or different educational resources, those kind of things, to keep those pumping through. Knowing a lot of people have a lot of different things, and just trying to both meter that out as well as sharing that information through different platforms, whether it's our website or social media or our newsletter. We're also looking at getting books out to some of the lunch sites, so that kids have books in their hands. And then also partnering with the CCR&R so that we can help support providers in some of the things that they need, including our preschool promise providers. We're just really trying to make sure that we're wrapping around our contractors, particularly our preschool promise contractors, to make sure that they have what they need and the support that they need. Some of them are closed. Some of them are accepting, other kiddos to come in. So we've got a variety of different situations depending. So those are some of the main things that we've got going on right now. We're, of course, as this goes on further, we're all just want to be poised and ready to do whatever we can do to support the community, whether that be through the CCR&R or other avenues.
That's great. Thank you, Lisa. Love the campaign idea of listing meal sites, et cetera. That's a great one that perhaps could be replicated around the state too. So great resource. Eva, do you want to talk a little bit about what's happening at your hub?
Sure. So recognizing that I serve both CCR and Hub, this will be a little bit CCR&R heavy. My team, I think, first off, was really interesting to me to be working within a K-12 and have a team that's all classified staff that was deemed as non-essential staff. So when K-12 closed, we had to go to bat to have our staff stay on, and really the language from the Early Learning Division about childcare being critical was essential for us to be able to argue that our staff was essential and that the work that they're doing really needed to continue through the K-12 shutdown. So spent the weekend on that, have a full team helping me out, which was great. So this week they've been really focused on reaching out to providers, finding out what they need, finding out if they're staying open, if they're closing. If they're closing, figuring out if we can get them into other programs. Hearing from a Preschool Promise partner who has extended their hours and gotten an exception to provide 24-hour, 7-day-a-week care, and trying to figure out how to support her with that with a shortage of supplies. Also recognizing that she has families that are keeping kids home, but wanting to keep slots for their return and what that looks like financially for them. Just lots of individual conversations, really falling back to those relationships that my team and our Preschool Promise person has with those programs and figuring out how to help them through it. So we've done a lot of sharing out of information that's come to us to programs and community partners. And right now we're preparing some information to go out on our Hub's contact list, also with community partners and our Hub's Facebook page. So really our focus has been on providers, but also trying to make sure that we link in community partners and having them understand that we're the go-to when they've got families that need care, or they want to stand up care, or they're closing care, and how we can keep people working.
Great. Thank you. Thanks for sharing. Jen, how about you?
Sorry, it takes a certain level of skill to get off mute. So we're doing a lot of the same kinds of things. We've really made a decision to only share OHA messages on our social media and website, so that we're sure that we're giving the latest and most accurate information. It's referring people back to OHA and CDC. But we're also sharing out resources like the meals. McMinnville School District is delivering meals to select bus stops for people to pick up food. So we shared out that information. We're also sharing information with our partners. Our social media is really parent-facing. So it's a different type of information. It's more resources that we're sharing out through social media. And then we also had a conversation with the CCO board last night. The board meeting was all about COVID-19 and our response and our needs. And one of the things that came up was the growing need for childcare and what's being done around that. And our Head Start director is on the CCO board, and she offered, she's closed down her facility because so much of her staff has children of their own. And so they weren't able to fully staff it, but she's open to the idea of using her facility if staff can come in from somewhere else to provide childcare for healthcare providers and other essential workers. So we also had a discussion about that on our leadership team meeting like an hour ago, and they're waiting for me to report back to them from this call what the Early Learning Division is doing so that we can help support that need in our community.
Great. Thank you. I think for all of you, as we go through this, we will have some follow-up questions that we may or may not get to today, but can also do offline. Beth, do you have anything you'd like to share with us?
It's everything that we're doing is in that same vein, really just trying to communicate clearly with our providers and our community partners. We have a pretty big listserv of community partners, nonprofit agencies, organizations that work with children and families. So we're trying to use that judiciously and not overload them. I think one of the issues that everybody's feeling is just like the onslaught of information that we're being given. And so we're just trying to be really conscious of when we do send out sort of the email blast, that it's the most up-to-date and relevant information for folks. And then our social media and website are all parent-facing too, because we're the Parenting Education Hub as well. And so that is really resource-heavy, and that's where we're getting most of our play with the community, just wanting to connect people with resources and services. But I really appreciate hearing what everybody else is doing. I love the books at the lunch sites. I think that's something we can definitely do. All of our school districts are providing takeaway meals. And then, our Head Start as well, I know is facing staff shortages. They have had all of their staff over 60 sort of shelter in place or just stay put. And so I imagine they're looking at staff shortages too, and would probably be open to conversations from the division around using their facilities if we could get some staff shored up there. So I really appreciate hearing what everybody's doing. It's I think we can all learn from each other of the avenues that we can take to better serve our communities. So
great, thank you, Beth. Probably just time for a couple more. Sarah, are you on the phone? Sarah Stevens?
Yep. Hi.
Hi.
Hi. I would say that we're really focusing on ensuring that our partners are able to continue providing those really essential services to kids and families, and have really played a problem-solving role. For example, we are working with our CCR&R to utilize our regional food bank's food truck that is still delivering services to get supplies into other communities for our child care providers. We've come up with some solutions around emergency food boxes for our kids and families, and have developed some strategies to make sure that those families that are isolated can get those deliveries. We've been part of innovative conversations with our housing authorities to make sure that those families are still accessing the services they need, even though those offices have closed to the public. And then our community has started a homeless task force that we've been asked to participate on to really think about those young kids and families that are experiencing homelessness and how we can provide them support through OHCS, Housing and Community Services. There are shelter funds available for our most vulnerable kids and families, and so just working with
our community action agency on how we can access those funds and developing partnerships with our local Red Lion to house some of those families within hotels.
Awesome. Thank you, Sarah. And then Brenda, are you on as well?
I am.
You'd like to share as well with us today?
Sure. A lot of things are really similar to what's been going on in other places. The work kind of stepped forward with our Child Care Steering Committee task force, so the group that's advising our child care accelerator work. And so the first wave of concern came from businesses with school closure, and then realizing that many of our Head Start partners follow the school schedule, so they would be closing as well. So over the weekend, we spent time contacting our after-school and non-school day partners to see what their capacity was and what their openness would be, and to have conversations with them, encouraging that they knew what the situation was and if they needed help expanding their employee base during that time. And so we put together a press release that included those resources that were opening up for parents as kind of a first blush at it, included all of the school district information from all of our districts in the region about setting up either grab-to-go or non-school day meal programming and what that looked like, and timing and locations. And then also shared information really for both providers and families about how to talk to your kids about pandemic. So really trying to be thoughtful about not traumatizing any more than it needed to be about this, and encouraging kind of open, forthright conversations. So that was kind of our first move into it. The partners around that table include very much our Child Care Resource and Referral, our chambers, through our Child Care Accelerator position, Central Oregon Community College. The next wave really was recognizing that we had a ton of things that we were going to need to cancel and reschedule, and one of the considerations that providers expressed a concern over is that our early childhood conference with the college, that is sponsored by our local chapter of the Association for the Education of Young Children, and the college and all of us around the table as the group planning that, was one of the major places that our providers get their certification hours each year. So as a aside to the more immediate, trying to figure out how we can convert as many of those training opportunities to web-based as possible, so they don't lose their hours during the year and have to worry about that. As our Child Care Resource and Referral and our licensing folks have been in contact with providers, more of our providers have moved to closure as of today. Part of them also were having like reduced numbers of kids coming into the program, and so they had concern about that. And then I know I probably missed it up front, but all those conversations about how they're having trouble accessing the supplies they need to maintain safety. So trying to figure out how to connect them to community resources. And then I think it was Evan that I heard talking about there's a lot of movement and informal kind of coverage of both childcare and how people are accessing other resources. So for us in Bend, they started up the Pandemic Partners of Bend, and They're including access to childcare on that and links to our information, helping drive them to 211, but recognizing that we don't have control over all of that, but also getting word out about the supplies that providers are needing that haven't been on the store shelves, particularly in our more rural areas, and helping get connections to things for providers that are staying open. And then we have the Central Oregon Emergency Information Network, which is for public health partners who have all of the OHA messaging coming through. So we're working very closely with them to make sure that the information that we're sharing is correct, current, and doesn't incite more concern that is warranted. So I think that's the high level overview.
Great, thank you. Thank you, Brenda. Thanks for everybody who participated and all 16 hubs.
Denise?
Yes, go ahead, Joan.
Denise, I'm wondering if we could just take a minute to have a couple minutes for Gwen to talk a little bit about some of the, I know people were sharing some experiences associated with Head Start, and I just thought it might be helpful if Gwen talked about that and what our work is right now related to that. Gwen, so I'm going to turn it over to you.
Thank you.
Sure. Hi, everyone. And I just turned on my camera. I'm sorry. I'm trying to get a packet ready that all of us have been working on for emergency childcare. So trying to move a few things forward. Yeah, so the program unit, we've been really busy on supporting many of the systems work that Joan and Margie mentioned at the beginning. And last Friday, we reached out and did an initial survey with all of our Head Start Relief Nursery programs, and then also sent to the hubs. You probably saw the letter that went out to Preschool Promise providers that came through you with the link, same link that we had sent out to Head Start and Relief Nurseries, just to sort of get a landscape of which of our providers were planning on staying open, which ones were closing, and also which ones were offering other types of services, whether that would be, phone call supports, referrals to services, would they still be doing like delivery or pick up meals. And so we just were trying to capture all that information. And so it's been sort of exciting. We now have a list of 72 different publicly funded programs that would be interested in offering emergency care. So it was a really kind of robust list. And what we'll be working on now is connecting that list into the master list that Joan and Margie were referring to earlier. That'll be with TRI, so that parents and providers can all go sort of through that one, kind of channel, just so that we're not having multiple systems. So that's kind of where we're at now. But unfortunately, we have had some more Head Starts as of yesterday and today that have made the decision to close due to sort of their local health authority and some guidance that they've been receiving for their community. So I think we just have 2 still open, but many of them, like I said, are available for emergency care. And one of the nice things too that the Head Starts have been working on is for those that have stayed open or plan on supporting emergency child care for first responders, is that they're also thinking about ways in which they can also provide child care to their workers who are providing emergency child care. So they've been really working on that. So I'll keep that in mind as we're kind of moving forward, as if that's necessary for others who are providing emergency care, but they can't do it on site, that might be a place where some of our local Head Starts can sort of help out as well.
Thank you, Gwen.
Joan, this is Sue. Can I make one comment and ask one quick question?
Yeah, hi, Sue.
Sure.
Hi, thanks. My comment is from the council's perspective. We had a meeting yesterday, virtual, and the council is well aware that a lot is going on at the hub level and the regional coordination level, and is very appreciative of the fact that you all are going to get out accurate, timely information, mostly probably supplied by OHA and the ELD, but also from your own regional local connections. So on behalf of the council, thank you. My question is around this issue of finding the emergency child care providers. And I'm a little confused about what's happening at TRI with that master list and what's the timeline on actually getting names and connections out to the communities that are looking for that care now, today.
Yeah. So what is your question, Sue? What do you want to understand? I'm sorry.
Yeah, I'm wondering how local communities who need these emergency child care providers are going to get that information of the names and contact information, how quickly that's going to get out of TRI to where it's needed.
John, do you want me to take that?
Yeah, why don't you and John start? If there's anything John can contribute, and then we can add more. Sure. Go ahead.
Okay. I will share the link with what's happening with TRI. So basically, we are getting the information into NACRAWare. So they're being coded as emergency child care. So 211, as they're getting calls, can respond and provide those referrals, the emergency child care, and CCR&Rs are equipped to do the same. So the list that is being referred to is actually the child care database called NACRAWare, and that's where it is. It's if parents go to hubs looking for these, the hubs would be best to refer them to call 211, and then they can get the list. So that's how it's set up. John, did you want to add anything more about how we're making sure the emergency child care is kind of going through the system to get qualified?
Yeah, can everybody hear me? Okay, yeah. Good. You know, what I would add, I think the other area that I think Sue's question was directly about sort of emergency child care. The other area that we are also working with the Research Institute on is having a process for people who want to help be the substitute pool or help provide emergency child care and be linked up with programs that are trying to open but don't have enough staff base to make it work. There will be a process where they'll be able to fill out an online form stating their interest, giving a little bit of background information about them. We'll be able to put those links on several people's sites and all of their social media so that people know where to connect in. And then what we're working out now is the process between folks who may be in early childhood programs currently that are not able to work because their program's closed down, but they want to be able to give back and provide assistance. So those will be the people we can fast track back into connecting them to entities that are standing up emergency child care. And then the process for people who are well-intending citizens who really want to get engaged, we want to make sure that there's a quick vetting process where they can get their criminal background check done, get access to some basic training on child care, health and safety, their CPR and first aid if they don't have it and they're actually going to be left alone with kids, child abuse and neglect prevention, and safe sleep if they're working with infants and toddlers. So all those things will be connected in that system. We'll be able to partner with the Office of Child Care to make sure that people who are not currently in the system are getting connected to the things they need to have, and that they get that background clearance before they go into the NACRAWare database. They'll actually be connected within that system so that then they can be referred to people who need workforce to kind of get things stood up again and up and running for our first responders. So there's kind of two tiers of response to getting people remobilized who are at home and already in the system, and then getting new folks who want to contribute connected up with programs that are ready to operate or up and running and still need additional staff. So I hope that wasn't too much information, but that process is being put together right now. Those forms should be done and connected up with the criminal background check process hopefully tomorrow.
And also the
Awesome.
emergency
Thanks,
childcare. The emergency childcare form, we expect that we're going to have that link available for everyone to put on their websites. So that will be part of the recruitment as well. So you would be able to have it on your website so people could click onto it and then go ahead and go through this process. I did see a question from Krista about the emergency or the first responders and hospital staff. And as I mentioned earlier, 211 is actually prioritizing them for referrals and coding that, so we can also track it as well. And also there is the need for referrals for those people who cannot stop working, who are perhaps grocery store workers or in the service industry where they need to work. They too will be provided priority referrals. But the plan, or what is happening, is they are providing these referrals using an enhanced referral process, which provides very up-to-date vacancy slots so that the first responders get a list with openings.
So I hope that addressed your question, Sue. Is there anything you need?
Thank you.
You're welcome. Okay, good. All right. I think in order to make sure that we have the opportunity to hear from, I know, other presenters that you all are interested in, I'm hearing we've already had 89 responses from providers since the survey just went out. So woo-hoo! We are reaching childcare providers to understand their needs. That's very great. So I think we're going to turn it over to Dana and Gwen. I think my name is on there, but I am not going to talk about Preschool Promise. Just support Gwen and Dana Dana and Gwen to address any questions. So Dana, we'll turn it over to you.
Awesome. Well, thank you all and good afternoon. And I really don't want to overload you with so much information because I think we're giving you so much information. So I'll go ahead and make mine as concise as possible. From Preschool Promise, we have extended the submission for RFA. All of the RFAs have been extended to May 4th, and that includes Preschool Promise, Equity Fund, Fiscal Agent, and our OPK kindergarten. So just keeping you all informed on that. We are literally, as we speak, working on the final touches on the addendum that we're going to be sending out here shortly. So we're hoping to go ahead and get that uploaded to the website. Included on the addendum, one thing for you guys to go ahead and keep in mind is that we now have the newly adopted salary guidelines for lead teachers and assistants. So just keep an eye on that. Should get uploaded by the end of today. And then it includes a page that tells you some of the minor tweaks, like, we added the salary guidelines, we've extended the deadlines, and so on. We are going to have our helpline available until the end of March for all of our applicants who are interested. So that line will be available once again on Wednesdays from 5 to 9, and then on Saturdays from 8 to noon, only to the end of March. We are still going to be taking questions on the RFA until April the 23rd. So I'm just giving you kind of like the important dates. You'll go ahead and see the whole calendar because that has been updated on page 4 or now 5 of the RFA that you can refer to, but I feel that that's super important. So keep an eye on the RFAs. Those are coming out. I'm going to go ahead and shift gears now a little bit into Preschool Promise. All of our Preschool Promise hubs, coordinators and directors received an email from me last Friday, just in regards to some of the Preschool Promise operating requirements. So just giving you in a nutshell, I think the most important one is we want our providers to continue to get paid even if they close, and we want their staff to continue to get paid even if the provider closes. So we provided some guidance on that. For our Preschool Promise hubs who also receive the CQI grant, we have a lot of trainings now that may need to get delayed or canceled. So we are adding that for entities who remain open, you can go ahead and modify your CQI plan to be able to go ahead and support those providers with any cleaning supplies or anything like that. So definitely open to amending some of those plans that coordinators have submitted as far as the use of CQI funds. There's a lot of surveys going out. Want to be mindful of that. I think one of the most important things for Preschool Promise is that we want your providers to go ahead and maintain communication with you as far as closures, and then you will go ahead and notify me depending on their closures. We know that a provider may choose to close this week, and maybe they plan to close until the end of the month. That may change, so we really want that provider to maintain communication with their Preschool Promise hubs. So that's one thing, but then on this other thing, there is that request for just Preschool Promise providers who are open to go ahead and help with their public, emergency childcare for first responders. So I did include the link in English and Spanish to let us know, because we understand that while some of the Preschool Promise sites may close, they may be open to letting others use their facility for this emergency childcare. So far, we've only received about 30% of our Preschool Promise providers who responded yes or no, I'm willing to help. So we'll go ahead and be sending out an email to them. So as you contact them and identify their closures, if you can remind them about that survey, that will be awesome. But just keeping it, high level, we're not going to be having a coordinator meeting for the month of April. We're just trying to go ahead and concise all the meetings, because you guys have so many meetings that you have to participate, but all of our individual check-ins and everything, they'll still stand. So just giving you a short list of Preschool Promise and the RFA. And that's all
Dana.
I
have
on
that. Dana, hi, this is Lisa, and I just want to make sure that I heard you correctly. Is the ELD reaching out to our Preschool Promise providers directly, or is that something that we're doing?
Well, I sent out the email last week for you all to go ahead and share that emergency survey, and we received a low response on that. So we were just going to go ahead and resend the link out to them so they can reply as well.
Okay. Yeah, we've sent that out, but I thought maybe I heard something different. Okay, thank you.
Thank you. Alrighty. So any other questions before we move into Ann?
Dana, there's a question in the chat box. I don't know. I can read it to you. Have you heard anything from ODE about reimbursing K-12 for transporting Preschool Promise children? The number one question I keep getting from district applicants, since the additional $375 in funding won't cover their transportation costs. That's from Beth.
Thank you, Beth. Great question. So on that, we have an email out to ODE. We know there's a reimbursement, and we're trying to go and figure out who will be the best person at the ODE that can tell us about the process and stuff like that. So more to come on that. And trying to get a little bit more information from ODE on that. You're welcome. Yay. Alrighty. Well, I made it mine very short and sweet for all you all, but at any time, if there's any Preschool Promise questions, concerns, feel free to call me, email me, text me.
It's great. Hey, Dana, this is Denise. Before we switch over to Ann, do you and Gwen have a sense of how many applications we have in right now?
Yes, I knew that question was going to be asked. So far, we're up to 278.
Okay, that's great. Thank you. Good news. Okay, Ann.
All right, I'm going to try to keep it short and sweet too. So just before this call, you all should have received from Denise an email that contained information about our budget estimates for grants for coordinated enrollment work and a sample job description for you all. This was sort of our follow-up from the Learning Collaborative, which feels ages ago at this point. And I think, the biggest thing I wanted to express today was, we want to get information out. And we also don't want to do anything to hinder the responses to COVID-19. And so with that, what we are trying to do is schedule some time for some group calls. There's kind of a natural two groups, those who don't have a preschool promise coordinator currently, for whom we're trying to see if we can get funding to begin hiring and training those people before July 1st. And then we have the group with preschool promise coordinators who we're looking at funding starting in July 1st in the new coordinated enrollment grant role. And so at this point, we wanted to just show you where we were, the estimates, again, because it's a grant. When we look at the budget, we will be receiving back from you all proposed budgets based upon the overall number. So we wanted to give you some insight into our calculations, but also know that you have the ability to propose back a budget that looks different from that which we just provided to you. And most pressingly, for that group of hubs that don't currently have a preschool promise coordinator, I believe you also got yesterday an email from Denise asking for some information about your fiscal agent and different information in the hopes that we could keep moving the funding forward on our end. And so please, if you can respond to that email from Denise with things like your DUNS number and your federal ID number. We are trying to see what we can get through. I'm sure as you all are experiencing, we too are trying to get a lot of money out for some emergency response as well, but want to make sure that if possible, we can keep moving things forward so that we're not creating additional crunches on time later in the summer. I think for the sake of time, I'll maybe just cut it short, knowing that we're going to try to be following up to start scheduling group calls to talk about the specifics of those two groups and the grants that they will receive, and maybe see if any questions are coming up for anyone right now.
Hey, Ann, this is Beth. I'm just curious, are the group calls sort of in preparation of training the coordinated enrollment folks, but it's not in lieu of training?
No. I mean, this is an evolving situation, but at this point, we're expecting training to happen later. This is sort of to get a sense of what questions are coming up, knowing that this is pretty unprecedented in how we operate during this time. So trying to kind of see what challenges, what opportunities there are when it comes to kind of getting the grants off the ground. But we expect the trainings to still happen in the summer and in a different format, unless we hear otherwise.
Okay, great. And real quick, it's, there is an indirect or admin cost built into those budgets, correct? Or is that something we could use for the base out of the base funding that's included?
I will have to confirm that. I'll need to go back and look at the numbers and see whether indirect is additional, or if we need to have that proposed back as part of the base funding. And I see that same question, so I can follow up with that.
This is Denise.
Thank
Likely, Beth, and everyone, any administrative overhead would be counted in the full 15%, just like it is with KPI and all other funds that come through the hub. But we will get confirmation on exactly if there is any limits or what those numbers would be, or if that's part of the overall 15%.
Okay, great. Thank you.
This is Eva. I just had a question about timeline. I think what I heard you say was that the grants would be from July 1st moving forward, but I thought that when we were at the Learning Collaborative, we were talking about hiring of staff in April. I'm just wondering how all of that fits together, and if there's maybe a revised timeline with the revised Preschool Promise RFA deadline as well.
Yeah, great question. So at this point, we don't have a revised timeline with the changes in the RFA deadlines. So those hiring for April, the intent behind that was for those hubs that don't have preschool promise coordinators currently, and that's funding that we are trying to get out the door before July, essentially as soon as we can, working through the current realities. And so for some hubs, there will be funding available to begin that hiring and be able to participate in training. And then for hubs that currently have Promise coordinators, the funding would begin July 1st, knowing that the current Preschool Promise contracts end end of June.
Gotcha. Thank you.
Anne?
Mm-hmm.
This is Brenda. On the timeline that was at the convening, there was reference to Summer Institute training, and enrollment for that has opened up, and I'm actually participating because it's being held in Central Oregon. I didn't see anything on the schedule as it's set up now that was specific to coordinated enrollment. Is there something separately that we need to plan on, or?
Yeah, and if Dana or Gwen are still on, I might see if they can help me with this. As I understand it, I think there was hope that we could include some of this training in Summer Institute, but I think because the schedules and the registrations passed, we're looking into something separate. But I'll pause and see if Dana or Gwen can give a little more clarity there.
Yeah.
This is Dana. I don't know if Gwen's still on the phone. Yeah, I mean, that was the intent initially, but as we're going through all this work in transition, we're looking to go ahead and do training here at the ELD, maybe a different type of training, so we can go ahead and get all of our new coordinated enrollment specialist training stuff. So more to come on that, but that was the hope, and now we're, strategizing.
Yeah, thank you.
And there's a question in the chat box.
Okay. All right, I see two questions. One, are we allowed to subcontract for coordinated enrollment specialist position? I will defer to maybe my ELD colleagues who are a little more familiar with our funding strategies there to see what may be allowable.
Joan, I don't know if you have an opinion or if we have an opinion on that.
I think we're going to need to look into whether or not there's implications associated with PDG versus SSA. So good question. We will add that to the list to follow up and get back to everybody about just as soon as we can.
Very good. Thank you.
And I see the second question for eligibility verification. Can there be multiple people trained to provide that function, or should it be a limited number of people? I think here is the sort of perfect area that we would love to see proposals for how to best make that work. As we shared at the Learning Collaborative, we sort of estimated at least a 0.75 FTE for all coordinated enrollment specialists roles, and then some variation based upon number of slots, but would, love to talk further individually about what makes sense in terms of how to split that FTE up or train multiple people on that. So flexibility to, I think, continue that conversation individually.
Thank you.
And can I just jump in here with one tip that we've used in the past around eligibility, because it is a lift every year, that we work with University of Oregon to get interns to help us just with the eligibility piece, because it's something that's contained and it's just document related, and we can train them up on how to figure that out. And so that's one idea for folks, if that works for your community, or you have access to students that are to college students that could help you with that work, just to run the paperwork faster.
Thank you. Yeah, that's great to hear about. All right, any further questions? Oh.
Great. Okay, folks, we will be sending out invites for those 2 group calls and then individual TA calls following as well. So be on the lookout for those in the next couple of days. We'll be sending out probably a doodle poll so that we can make sure that we get everybody on those calls. But we do want to work as quickly as possible, specifically with the non-preschool promise to get that grant for you to get started and to start having that conversation. So be on the lookout for that. And do keep your questions in mind so that we can have those for the discussion once those calls are preset. And so with that, we're going to go over to Brett now to give us an update on ELD's and ODE's work with the school districts on the numbers memo.
Hi, good afternoon, everybody. So the update on the work that we're doing with ODE in regard to district-operated ECE programs that will be included as part of school districts' plans that they submit to the department for student investment account funds is really pretty limited. To my knowledge, and based on what I've heard from colleagues at ODE, they are planning to move forward with their timeline for reviewing those applications as planned until further notice. So there's no real update to be had there. We are providing them with information around practices related to instruction/adult-child interactions in these ECE programs, as well as assessment, and basically really encouraging them that as they're working with school districts to make sure that they're not building in the kindergarten assessment as a way to specifically evaluate these individual programs, and really making sure that we're using the KA as a high level population level marker and not get too fine with it. So there's some work happening there. We'll also be working with them around longer term progress markers for these programs, but that's really all that we know for now. Hang on, I may have a real-time update for you because I just received an email from them. Yeah, I'll have to take a look at this and get this out to you if there's anything substantive there. The other thing that I wanted to, so for now, I think the upshot with these district-operated ECE programs is just steady as she goes, and we'll see what we get over the next few weeks and months, and we'll keep you updated. Other things that I wanted to update you on are in relation to KPI. So for those of you that did not expend all of your Q1 resources over the summer, that rollover is in process. So those funds will be added to your remaining KPI balances. What that means is that you will be getting an amended KPI grant agreement that we need you to sign and get back to us. That's what allows you to access and use those funds. You'll see them in eGUMS. I have had a couple folks, because each hub currently has two KPI grant agreement or two KPI subgrants in eGUMS, have had a couple situations where folks are actually drawing from the wrong subgrant. If you're not sure which one to use, make sure you're drawing funds from the one that has a lot more money in it, because the one that you may still be able to access that has limited funds in it, that was the Q1 funding. So if you have questions, just let me know. But the big thing that we wanted to get to with KPI is getting back to this question that Krista asked in the chat box about 20 minutes ago. Should we find out that there are child care materials needed in our region, and are we able to utilize funding streams to support provisions for them? And the answer from a KPI standpoint is we want to create as much flexibility as possible right now to be able to support these emergency child care programs, both programs that are being set up to support first responders and healthcare professionals, and existing programs that may need support. So when we went back and looked at the KPI grant agreement, we built in provision around allowable use of funds pending agency approval for things that aren't explicitly listed in the grant agreement. So what that means is if you see a need and you want to either reallocate KPI funds that you've already allocated, or if you have funds that have not yet been allocated and you see a need, let's have a conversation about what that looks like so that we can get that built into the work plan and we can talk budget. But the bottom line is that we're going to be as flexible as possible with you and work with you as much as possible to make sure that the programs that are being that are either continuing to operate or that are being put in place on an emergency basis in your communities have what they need to support children and families. So, you know, please feel free to reach out to me. And for those of you, you know, like I know Lisa said earlier, needing to cancel an event that they had scheduled for the first weekend in April. I imagine that will be the case for many of you. So we'll be certainly looking at adjustments to work plans and things of that nature. So let's just have those conversations, and, you know, please don't hesitate to reach out so that we can figure it all out together.
Thanks, Brett. It looks like we have a question in the chat box associated with the numbered memo. It seems like perhaps not everyone believes they've received it yet. I'm assuming we could easily share that with all the hub directors. I thought that we had, but perhaps we have not.
Yeah, we'll make sure we get that out.
Thanks, you might have, and I just missed it, but my friend Krista sent it to me too, so thank you.
Right. Any questions for Brett associated with either the work that we're doing with in partnership with ODE or the KPI thoughts there for Brett before we close that part down? Well, we have a few minutes at the end of the call that we left to see that we now have 229 responses from child care providers in the survey regarding their needs. So I think that that's a great marker for being there to help to try to address what people need. And please encourage folks as you're able to continue to get in there. And John put in the chat box that, you know, we don't have at this point in time, it's not an answer by this date or we don't care what you need, that we're planning on leaving the survey up so that we can continue to see as providers' needs are emerging. We're imagining they could change. And we may close it at some point and field a different one if things do change in ways that we don't anticipate. But at this point, it's going to be open for the foreseeable future. So one of the things that we've been thinking about here at ELD, we're anticipating, for example, having weekly touch base or more frequently as needed touch base with the CCR&R directors. And we wondered if during this time of the public health emergency, what your thoughts would be on, would you be interested in having a weekly touch base? It wouldn't necessarily be for an hour and a half. We could schedule it for an hour. We're just wondering if that's helpful or if you'd rather just have us schedule additional times as needed. So we'd be interested in hearing your thoughts on that.
This is Beth. I'll chime in. I think for me, the as needed meetings would be great. I don't necessarily need a weekly check-in, but as things evolve and change as they are every 15 minutes, it seems like, having those sort of ad hoc meetings are great. And just really, while I have 2 seconds, just really want to shout out my appreciation to all of you at the division. I know you're working incredibly hard, sort of a million hours, and the communication has been really clear and timely, and the flexibility that you've brought into the system to respond to the needs of providers and partners and families has been, I think, exemplary. So I just really want to shout out big love to all of you guys and just really appreciate that, and just want to acknowledge and honor the work you're doing. So thank you.
Thanks, Beth. Beth, we appreciate that very much. Whoops, sorry, I got a dog here.
This is Krista, and I just wanted to share another thing. Because I've been working closely with the regional solutions guy who's coordinating economic development infrastructure, In the region, I've also been on an email list of opportunities and things that are being built to support small businesses and also families or people who are not working because of closures of one kind or another. And I think that directly impacts things like making your rent or buying groceries, and those are some of the biggest stressors for families. So I would just encourage folks, and I don't know if the Early Learning Division can do anything around this, but continuing to get information out to our boards and our key partners about the infrastructure that's happening locally around possible federal supports and or state supports. Like Multnomah County today made that decision about not doing residential evictions. So, you know, there are policy efforts that are happening, and I think that that kind of communication that can also find its way out is I feel like it's a great role for our hub and for our boards, and I just would offer that to colleagues, and also just touch base with leaders at the ELD to see if you all are hearing anything additionally around those really nuts and bolts parts of our families' lives.
Thanks, Krista. Well, there's a lot of, as you have described and others, a lot of different moving parts and a lot of, I think, thinking about how do we, how do we really support families and communities. I definitely will share the information that you shared today at our end of the day meeting around regional solutions and making sure that we're all connected there. And then one of the things I didn't really talk about too much are some of the other sorts of funding that we're exploring to support, in particular, childcare, small businesses, as well as the funding that we're looking at providing related to those sanitary supplies and et cetera, not just finding access, but actually paying for those supplies. So we'll know a lot more about what that funding picture is going to look like in terms of whether or not we'll be able to offer, for example, grants to providers to stay open, those kind of things in the next few days. And if it seems worthy, once we know, to ask you to hop on the phone, we'll do that. I know we're still sussing out, and I would encourage you to let Denise know, ad hoc or scheduled. If you don't want to do it on the calls, put it in the chat box or email her afterwards. But I'd like to hear from a few more people before we make a decision on that. Well, I just want to thank everyone for taking the time to participate in the call and for all the dedication and commitment and work I know you're all doing in your own communities. And if there's anything that we can be doing to help to support you or things that would be helpful for us to be thinking about, of course, we want to know what those are. And thinking about all of you, I know we all are, and I hope that you're staying safe and staying healthy and taking care of your own families and how important that is in this time. And we look forward to talking to you again soon. So thank you very much.
Thanks, everyone. Take care.
Thank you.
Bye.